will ask you to unmute at that time. So we'll be moving to Q&A after we've heard remarks from our three speakers, but for the moment, you'll be muted. So we'll get started here shortly. All right. So I think we're going to go ahead and get started. Again, my name is Nitu. I'm the Alameda County Public Health Department Public Information Manager. You are joining the Alameda County Point in Time Press Conference. If you are a member of the media, please add your outlet to your name. You are muted at this time, but when we move to Q&A, we'll ask you to raise your hands for questions, and then we'll ask you to unmute at that time. So I'm going to go ahead and get started. We have three speakers today. Tamika Moss, founder and chief executive officer of All Home, will be starting us off. Then you'll hear from Chelsea Andrews, executive director for Everyone Home, the collective impact initiative that facilitates the Alameda County Continuum of Care. And then you'll hear from Carrie Abbott, director of the Alameda County Office of Homeless Care and Coordination. So again, we'll take questions after you've heard from all three speakers. You'll be asked to raise your hands, and at that time, we will unmute you to ask your question. So with that, I will ask Tamika to get us started.
Thank you, Nitu. Good morning, everyone. My name is Tamika Moss, and I am the founder and CEO of All Home. All Home is a regional organization. We work across the 9-county Bay Area to help address our challenges around homelessness and housing insecurity for our most vulnerable neighbors. And I'm really pleased to be here with our partners in Alameda County and Everyone Home to talk about the point in time counts. I think what's most important today is to understand how significant it is that we've been able to stave off a catastrophic increase in homelessness during this time of the pandemic. We have not actually conducted a regional or a point in time count since 2019 in many of our counties across the region. And it is extraordinary that we have been able to support people in staying in their homes through this period of time, resolving the housing crisis for so many of our brothers and sisters who have been outside, and the discipline and the hard work of our community-based organizations, regional partners, our counties and our cities is reflected in the point in time counts preliminary numbers that you're going to be hearing about today. I think the first thing I wanted to say is that homelessness is a regional issue. We think it is critically important that our counties and cities and everyone in our community who is addressing this crisis is working in alignment and coordination across our region. We know that if no one city or county can do this alone, it takes everyone in our community working collectively together to reduce and end homelessness in our community. And I think you can see that based on what is working. We have evidence and data-informed solutions that have been put into place over the last several years. And you see across the region, across many counties where investments have been made in producing more permanent supportive housing, investments in prevention and investments in emergency housing for folks have really worked. We actually know how to address this challenge. And I think what is positive about this, the numbers that you're going to hear about today, is that those numbers actually reflect people. We are working diligently to ensure that we reduce the number of our neighbors who are on the street. And I think solutions like the state and local eviction moratoriums, our emergency rental assistance kept thousands of people in their homes. Home Key and Room Key, the state programs that produced temporary and interim housing through hotels and motels, and now are being converted to permanent housing. Those types of solutions are happening all across our region, and we believe help to minimize how many more folks were experiencing this challenge during this period of time. And I want to say before I turn it over to Chelsea, although the numbers in the point in time count are better than we anticipated, homelessness still continues to be our region's and our state's biggest challenge. And unless we start to really focus on some of the roots of this that have preceded the pandemic, structural racism, the lack of deeply affordable housing for all of those who need it, and being able to provide that housing solution quickly and responsively, we have much more work to do, but I am really proud to stand by all of our partners across the region who have been working diligently for the last many years, and those are the numbers that you are seeing today. So we know how to do this. This is not guesswork. We have data-informed and evidence-informed solutions, and I'm happy to be a part of this press conference today, and we'll be happy to be in the discussion later on. I'll turn it over to Chelsea. Thank you.
Thank you so much, Tamika. I'm Chelsea Andrews, the Executive Director of Everyone Home, and welcome you to this press conference. We'll start with a slideshow that can walk us through the information you'll hear today. Next slide. So the point in time count, what is it? It is the count and survey of sheltered and unsheltered people experiencing homelessness on a single night. It's required by HUD, and it is what truly informs the funding that we receive from the federal government and others for homeless services. This year in Alameda County, the count was conducted as a visual count on Wednesday, February 23rd, and then the subsequent weeks following the count, a survey took place to gain more additional information from those experiencing homelessness. Next slide. And so one of the sentiments that you may have heard expressed from Everyone Home before is the fact that this count counts more than any count before. And we say that because we know that there has been 3 years, as Tamika mentioned, since we were able to obtain a census to let us know how many of our neighbors are experiencing housing instability and homelessness. We also know that during these last 3 years, we've been in the midst of a pandemic that's been unyielding. There's been significant job loss. There's been housing insecurity. And of course, this public health crisis that has been troubling for our most vulnerable residents. At the same time, we've witnessed an infusion of resources that were higher than we've ever seen before, from the state, from our federal partners, from our local cities, from our residents and neighbors. And we know that through various policies and prevention methods, as Tamika mentioned, eviction protection moratorium, emergency rental assistance, mortgage forbearance, student loan forbearance, all of these factors, policies, and resources help stave off an increase that could have been insurmountable of first-time homelessness. The results from this count demonstrate the power of community and investments in ending and preventing homelessness. Nonetheless, we are faced with the stark reality that a crisis continues to exist, and these investments and policies were short-term. We know that we will have to find additional resources now to avoid homelessness increasing exponentially in the future. I'll now walk you through the data that this PIT count revealed for Alameda County. Next slide. So some key considerations with this year's point in time count. For the first time, we modernized the point in time count and utilized a phone application tool, which allowed for geo-tracking and more accuracy with our results. We also relied heavily and thank our regional and jurisdictional outreach teams who helped ensure that we had the most accurate count possible. We expanded our family surveys and modified the methodology to count families. HUD modified the methodology and we took advantage of that so that we can get a more accurate count of our families working in partnership with nonprofit providers as well as school boards. That did result in an increase in our families counted, but we do believe it to be a more accurate depiction of our families experiencing homelessness. We also utilize the HUD required methodology to determine the approximate number of individuals in each tent, car, and RV. Next slide. Across the board, we experienced as a county a 22% increase in homelessness over the course of the last 3 years. What you will note is that the significant portion of the increase that we experienced was in our shelters. There was a 53% increase in shelters, which we know is attributable to additional shelter beds being developed throughout our county over the course of the last 3 years, as well as emergency shelter that was put in place in the midst of this pandemic through federal, state, and local resources. We did see a slight increase in our unsheltered population of 13%. One thing to note is that while there was a 22% increase in homelessness, prior to this time, there was a 20% increase occurring annually. So we consider this to be a huge success and a direct reflection of the additional resources that were infused into our system. Next slide. There are some other countywide trends. We note that there were 53% decrease for homeless individuals with HIV and AIDS. We also noticed some varying results with our veterans. There was a 21% decrease in homeless veterans, but we did see for those veterans experiencing homelessness that there was a 117% increase in chronic homelessness. There was a 22% increase across the board for chronic homelessness. And overall, we as a county continue to see an overrepresentation of people of color that are homeless, especially those that are Black. There was a 39% increase in car, van, and RV homelessness, totaling close to 4,000 individuals. We will know more about what that means in terms of who these individuals are, the demographics and their needs once we have an opportunity to get the survey data that we expect to obtain towards the end of June, beginning of July. Next slide. The additional more rich data that we expect to obtain in June, at the end of June and early July, will provide a much more comprehensive understanding of those experiencing homelessness in our county. It will include racial demographics. It will include the homeless city of origin for those who were surveyed, give us an indication in regards to how many individuals are first-time homeless versus chronic homelessness. We'll be able to obtain insight in regards to what could have prevented someone's homelessness and their experience with our system, and additional insight in regards to the car, RV, vehicle homelessness in our county. Next slide. We worked with multiple partners over the course of the last few months to make this point in time count a success. I want to acknowledge and thank our partners at Aspire Consulting, at Alameda County HCD, ASR, as well as Alameda County Healthcare Services Agency, Office of Homeless Care and Coordination. Next slide. Additional information regarding this year's count can be located on our website. Please visit our website where you will find detailed information related to this year's count and specific city information as well. And with that, I'd like to pass it over to my colleague, Carrie Abbott with Office of Homeless Care and Coordination.
Thanks so much, Chelsea. Again, my name is Carrie Abbott. I direct the Office of Homeless Care and Coordination in Alameda County's Healthcare Services Agency. I did want to look specifically at the impact of COVID on our homeless population in Alameda County this year. Some things that we saw. First, we had an increased shelter response to the pandemic, and the needs for at-risk homeless populations led to a higher sheltered percentage in 2022. In 2019, we had 21% of our homeless population in shelter. In 2022, we had 27%. We saw a 900 bed increase overall on the day of the count, and we know that we were still lower in terms of shelter capacity in our traditional emergency shelters because of social distancing. We believe that those resources really helped to keep those at higher risk for COVID much safer. We saw 70% of the people exiting those room key hotel programs for seniors and people at highest risk have moved to housing. We followed the CDC and California Department of Public Health guidance to avoid the spread of COVID caused by disrupting encampments. We worked with a moratorium on encampment disruption for the majority of the pandemic in order to keep from spreading the disease. We also saw an influx of prevention funding and an eviction moratorium that we believe really staved off a much more dramatic increase in homelessness. So beyond COVID, some specific things to note about Alameda County. We did see a continued increase in homelessness along with rising housing costs over the last 3 years. We saw a 9% increase in rent since 2019, something that our lowest income residents in Alameda County could ill afford. Some of the positive news we saw are that the exits to permanent housing were up in 2021, including those exits from the room key hotels. We saw notable decreases in homelessness among veterans and people with HIV and AIDS. And we saw much slower increases from this count to the last one than we had in the previous 2 counts. We had been seeing 20% per year. Over the last 3 years, we saw 22% total. We're very glad to see those rates decreasing in terms of the year over year numbers. And of course, we know how much more we need to do to try to dramatically reduce homelessness. To this end, Alameda County partners, including Everyone Home, our 14 jurisdictions, our service providers, and our county agencies have endorsed the Home Together 2026 plan to end homelessness. And we're going to share a couple of slides on Home Together. The Home Together plan is a 5-year ambitious strategy that decreases homelessness while focusing on racial equity and is driven by the input of people who've been homeless in this county, are critical voices in forming this plan. Next one. The Home Together plan overall provides the goals and costs with recommendations from our racial equity analysis and system modeling, and embodies that commitment to center racial equity and lived experience as we continue to see dramatically disproportionate rates of homelessness among African Americans in our community. Very specifically, we describe the population in Alameda County, look at our inventory, and then identify and estimate costs for all of the additional services and supports that we need over the next 5 years. It establishes specific implementation goals, activities, and metrics. Next one. So these are the numbers that we're looking at that we need in our system in order to end every year with no unmet need among people experiencing homelessness. We need more than 4,000 additional supportive housing units. Those are permanent units for people who need ongoing support. We need more than 3,000 units for people who are older adults and frail adults. We need more than 10,000 dedicated affordable units for people experiencing homelessness that come with ongoing economic support and lighter services. We need more than 5,000 shallow subsidies that could prevent people who've been homeless before from coming back into homelessness. And we need more than 1,600 additional rapid rehousing slots or units for people who are able to increase their incomes over time. That comes to 24,000 new units or subsidies, and at a cost of over $2.5 billion over the course of 5 years. The impact of this, though, would see our annual households accessing our system decreasing over the next 5 years, would see the households served in pathways to housing increasing, and our unmet needs would drop to 0 at the end of year 5. Next one. Thank you. Yes. So we have shown that we know how to make a difference in homelessness. We have an ambitious strategy. We look forward to implementing together. This strategy will not be possible without additional resources in our system, particularly housing and housing subsidies. Results in this count, though, show the critical importance of making those investments and how those investments will play out over time. I think now we move to questions and answers. Neetu?
Thank you, Carrie, and thank you to Chelsea and Tamika. So at this time, if there are any elected officials who would like to make any remarks, please raise your hand and we will unmute you and invite you to share your thoughts. And if not, we will move into Q&A. So I'll just give it a moment to see if we have any of our elected officials who would like to speak. Okay. And if that changes, you can go ahead and raise your hand and we can take you during the Q&A. So we are going to move to the Q&A portion. I wanted to note for folks that we do have a hard stop at 11:30. So at that point, if there are still questions, we'll ask that you direct them to the respective points of contact for the press releases that you received today. So if you have a question, please raise your hand and we'll invite you to unmute. For the purposes of the recording, please speak your name and media outlet when you do ask your question. Just one kind of ground rule for folks to allow everybody time to ask their questions. If you do have a follow-up question, we'll allow one follow-up question per person, but then we'll ask you to move back into the queue and raise your hand again to ask any additional questions that you might have. So for now, if you have any questions, this is the time to raise your hand. All right, so our first question is from Supriya from Berkeley side. Supriya, please go ahead and unmute yourself.
Hi. My question, I was hoping you could, I think this is for Carrie, if you could repeat the numbers about how many people who have exited room key and home key into permanent housing.
Yes, thank you. So of the people who have exited Project Room Key Hotels, so the hotel set up for shelter in place for people at very high risk from complications if they were to get COVID, we had over 2,000 people exit and over 70% of them have exited to permanent housing.
Thanks, Carrie. Thanks, Supriya. And again, if for folks, for the purposes of the recording, if you can speak out your name and media outlet, that would be great. Do we have any other questions? I don't see any other hands. And if we don't have any questions, we will end early. So we won't hang out for the whole half hour or so that we have left if there are no more questions.
Neetu, I just wanted to, while people are getting their questions together, just to share that we will be sharing county by county contact information on our website as the counties release their data. San Francisco has just done that, as well as Contra Costa County. So just to remind folks, if you can go to allhomeca.org for any county contacts across the region.
Thank you. And we do have another hand. So Michael Singer, Castro Valley Forum, San Leandro Times, please go ahead and unmute yourself.
Yes, thanks for taking the question. The first one is essentially, because this is a 3-year measurement as opposed to a 2-year measurement, how are you accounting for that extra year? And as a quick follow-up, what would you say is the biggest contribution from the state and the federal government in terms of mitigating the number of people who are unhoused?
I'll take the first question. I think that the fact that it's a 3-year count, it's consistent across our region in particular. Most of the cities and the counties and the CLCs requested an extension of time. So it does allow us to have some data point that's kind of comparable and relevant for us. It is something that, of course, every year we do still have to provide shelter data, which we did provide to HUD. So we did know on an annual basis what our shelter count looked like. But it is a little unique in the sense that we would have typically had data over the course of 2 years. And so, you know, of course, just working with what we have and having to take those findings and extrapolate as we can, but really challenging because of the time frame that elapsed in the pandemic that was ongoing. And then in regards to the biggest investment, I'd be curious to know if Tamika wants to weigh in on this one.
Yeah, thanks, Chelsea, and thank you, Michael, for the question. I think the most impactful investments from the federal government were really around rental assistance and the investment that the state used to fund home key and room key projects, the ability to actually bring folks into hotels and motels to shelter in place and reduce their exposure to COVID was incredible. And the rapid nature that those funds were deployed to cities and counties across the region, across the state, allowed folks to act quickly. The urgency here is part of the most significant part of the investments, that those dollars were really infused into communities quickly. We relaxed zoning and regulatory barriers that typically challenge folks from acting quickly in terms of securing interim and emergency housing. And then I think the other significant investment in then the capital funds to purchase and preserve those units as permanent supportive housing is allowing us to increase the number of units across the state and region for people, as Carrie said, to transition out of the shelter in place hotels and into permanent housing. So those investments, I believe, helped a great deal, as well as really helping those who were precariously housed, those who were living in vehicles or on couches, to access rental assistance in a really timely manner that prevented them from becoming homeless in the first place. I know that all of my colleagues on this call believe that prevention is critical. It is one of the most cost-effective interventions that we have. And I think that suite of investments allowed us to see a lesser increase.
Going to also chime in here in terms of something that was historic and never happened before, and that's vouchers. The emergency housing vouchers that the HUD allowed for CLCs to work in conjunction with public housing authorities was historic. The first time homeless or individuals were prioritized to receive vouchers, and our county received over 860 plus vouchers and are working diligently on assisting individuals obtain full-time permanent secure housing with the voucher. So that was also a novel resource that we are very fortunate to have.
Thank you, Chelsea, and thank you, Tamika. So with that, Marissa Kendall, Bay Area News Group, please go ahead and mute yourself.
Thank you. I was wondering, is there a concern that now that the pandemic is, winding down in some senses, that we won't be able to continue some of the successes and the gains that we've made? I know there's been some concern with ongoing funding to keep the home key sites operating and some of the other emergency sites. Is there a worry that once all of this pandemic aid dries up, we'll go back to seeing the same level of growth that we saw before?
I can start. Yes, Marissa, thank you for that question. I think that that's a very real fear as we're seeing the end of the declared health emergencies. We know that there will be resources that are no longer available. We in Alameda County still have several hundred rooms open under Project Room Key, but the funding for those rooms is waning. And we have not seen a lot of new home key funding in this current round. We have another, I think, 1,200 units worth of home key housing teed up as new funding becomes available. But it's unclear whether those projects will receive funding before FEMA funding ends and room key funding is no longer available.
Maybe I'd just chime in also, Marissa, to say that that's part of why our advocacy efforts are so critical. We really believe that both the state and the federal government really need to work with local jurisdictions to provide ongoing permanent sources to address the housing and homelessness crisis, both across the state and across the region. And before, Governor Newsom began to provide significant increases in funding toward this challenge, we did not see a lot of state leadership doing investments in housing and homelessness at scale. And we most certainly had not seen that before the Biden-Harris administration from the federal government. So what we know is it takes investments, ongoing, dedicated investments that are targeted toward solutions that work. You can't have a persistent housing challenge for 50 years and have 3 years of funding to try to address the crisis. And so we need those consistent, permanent sources, and localities are doing that. San Francisco, part of why they saw a decrease in this point in time count is because of Proposition C and other investments that the mayor and board of supervisors are making. We need all levels of government, including our public housing authorities and all the partners, to really make a commitment so that, as Carrie described, over the next 5 years, if we can make those investments at scale, we can actually get to functional zero. And so I think the advocacy is more important than ever to communicate both our regional needs to the state and federal government partners.
Thank you. All right, we are going to move on to our next question. Zach Haber, I think you've identified yourself as a freelance reporter. Please go ahead and unmute yourself.
Hi, thanks. February 23rd was a very cold day. It was the second coldest day in Oakland. Do you think that the cold temperatures had any effect on the total numbers that showed up in the count, such as people doubling up and staying with relatives when they normally might not? Or do you think it had any effect whatsoever?
Thank you for that question, Zach. In fact, it definitely was cold, and everybody who was there was able to witness firsthand how clearly we were able to identify individuals and vehicles that were experiencing homelessness. One of the key considerations for our point in time count this year is that we did see the increase in individuals and vehicles, and we do believe that we were able to see more clearly this year because of you could tell when a vehicle was on and occupied. There also are other considerations. There's some speculation that individuals might have gone inside to a hotel with friends or with family members because of how cold it was that night. So of course we can speculate, but one thing we do know for certain is it allowed for a more accurate depiction of those who were definitely unsheltered in vehicles on that night.
Thank you, Chelsea. Carrie, Tamika, did you have anything you wanted to add?
I just wanted to add, Zach, one of the challenges with the point in time count is it has its limitations. I mean, I think Alameda County did a tremendous job of modernizing the count process, really trying to be as comprehensive as one can to ensure that we are counting folks so that we can apply the appropriate resources and interventions to support those individuals and families. But the fact of the matter is, one count per 1 year in the winter is not reflective of the sort of root causes of homelessness that we must address, as well as just how many people are vulnerable in our region. So I think it's important for us to know that this is the best tool that we have, and yet we know that it has some vulnerabilities.
And just to add about the cold weather, completely agree about, every year there's something different with the point in time count that could change things a little bit. But with the cold weather, our hope was that more people came inside and took advantage of the shelter beds that we have available. So it may have actually increased that percentage as well.
Thank you. I don't see any more hands raised, so I'm going to ask if you do have a question, please raise your hand. As a reminder, we do have a hard stop at 11:30, but if there are no questions, we will end early. So please do raise your hand if you have any questions at this time. This is going to be, all right, there we go. All right, Supriya, I'm going to ask you to unmute.
Hi, Supriya with Berkeley Side. This is a bit of a more specific question about the type of unsheltered population. Might be in the later on data sets, but in Berkeley, our population that is living on the street in tents went up quite a bit, which is not what was seen throughout the county. And I was wondering if anyone could offer an explanation to that, or maybe explain why they didn't see that in the county.
I would just note that I think we're going to have a lot more information as we sort through all of the survey data. We will have asked people who are staying in tents, where they had been previously and how long they've been homeless, so that we can look for trends in that. But all of that data isn't complete yet. So I hope that we can provide a more complete picture in the coming weeks.
Great, thank you. Chelsea or Tamika, I don't know if there's anything you wanted to add. Okay. All right, one more time. Are there any questions for our speakers? I did want to note, you may have seen it in the chat, that this presentation is being recorded, and the link will be available both on the Everyone Home and on YouTube, Everyone Home's webpage, and I believe it'll be emailed out. But again, are there any questions for our speakers? Please raise your hand if you have a question. Did we have any representatives from the cities or our elected officials who are on the call who wanted to share any remarks? If you do, please raise your hand and we'll unmute you. Michael, I see you. I'm going to give it 1 second to see if anybody. All right, Michael, I'm going to go ahead and mute you. Michael Singer from Castro Valley Forum, San Leandro Times. Please go ahead and unmute.
Yeah, I'm not an elected official, so that's just to clarify. Anyone on the board or in the leadership team, did you get a chance to actually go out yourself on that count morning? And if you did, can you kind of give us in the press and the public a sort of a person on the ground meeting other people who you're trying to help, and what was that experience like for you?
I think so. I think Chelsea and I were both out counting in Alameda County on that morning, and we do ask volunteers who are participating in the count not to engage in that moment. It's really just a visual count. The information that we get from the surveys happens during the same time period, but not as part of the count, which takes place in the very, very early hours, because we're looking for people who are sleeping outside. And then the shelter count also has an individual survey. I did, just my perspective, we had a lot of volunteers, especially given that it was still during the pandemic and is still during the pandemic. People were really motivated to get as much accurate information as possible, knowing that it had been several years. And it was absolutely very cold. We saw very many people, fortunately, very bundled up in sleeping bags and tents and in vehicles. So that was my personal experience in Alameda County. And Chelsea, I know you are helping coordinate the pit stops as well.
Absolutely. Thank you. Great question. And I think Carrie hit the nail on the head in terms of really the concept in terms of not disrupting individuals while they're resting. But I will say that this year, for the first time, to thank volunteers, knowing that we were conducting this count differently, where teams went out on their own. We had pit stops for the pit count across the county, where we thanked our volunteers. And I'll share that a part of thanking our volunteers, there were individuals across the county who were experiencing homelessness, who stopped by to see what was going on. And a part of that include thanking our volunteers for taking the time to really try to ensure that they counted, and really having a lot of appreciation for the work that we do. And so that was, of course, reflected across the county, very heartwarming experience. But other than that, that was really where we had an opportunity to connect and feel more of that direct engagement with those experiencing homelessness.
Thank you, Chelsea. Thank you, Carrie. All right. Once again, we do not have any hands in the raised. So if you do have a question, please raise your hand. Again, we do have a hard stop at 11:30, but if we don't have any questions, we will end earlier. If we have any representatives from our cities who are here and are interested in providing any comments, please also raise your hand and we are happy to unmute you. So we'll give it a little bit of time to see if we get any more hands. All right. Carrie, Tamika, Chelsea, if there's any closing remarks, if not, I will close us out.
I just appreciate everyone being here to learn more about the homeless count and our people experiencing homelessness in the county, and being there to work with us to try to end this crisis. Chelsea?
Absolutely. Want to, of course, thank Tamika Moss with All Home for joining us this morning. The work that she's doing across the region to bring us all together to have a big picture and big impact in terms of advocacy on behalf of those experiencing homelessness is remarkable. And we thank and appreciate you for your time. Also, thank you, Nitu, for helping facilitate this process for us today. Of course, if there are subsequent questions, please feel free to utilize the press release to send your questions and to receive response. We hope that you continue to follow this issue and continue to, quite frankly, highlight the fact that with resources and with aligning support across our county, we can see a decline in homelessness. And so hopeful that you take that away from today's press conference.
Thank you so much, Chelsea. I just wanted to say a quick thanks to you and everyone home, and Carrie, to you and the county for your tireless efforts, both around this count, but also every day. You know, the one thing I'd like to say as we close is that this is our collective challenge. This is the social issue of our time. And no matter if you see increases or decreases across cities and counties, we are all Bay Area residents. We are all residents of our community and responsible for addressing this challenge together. And I'm just really pleased to see the level of alignment and coordination across our counties and cities. And I look forward to doubling down, increasing our opportunities to really, really see significant reductions in this crisis over time. So thank you for allowing me to be with you this morning.
Thank you, everyone. Thank you to our speakers, our city and county representatives and partners who joined us today. I also wanted to thank the members of the media who joined us. We always appreciate the service that you provide in sharing this important information. There are a couple of important links in the chat, so I would refer you to those. And as Chelsea noted, please refer to the press releases for subsequent questions that you might have for your points of contact. Thank you so much for joining us. Have a great rest of your week, and I'm sure we will be talking to you again soon. Thanks, everybody.